Listeners have been hearing your commercials, and we know that you just love horses and you love to treat all kinds of horses. And you're an ambulatory equine veterinarian. So tell people what you do.
Yes. So what I do is I take your call or text, and if you need me, I am fully equipped in my truck, and I'll come to your farm and we can deal with whatever is going on with your horse. I'll start with walking into your barn or seeing your horse in your field, standing quietly. I love horses, so I just like to look at them and try to think of what kind of horse they are and how much I like them, and see if they're acting normal or not, and speak with the owner or handler to get a good idea of what the owner's complaint is, and if there is a history on the horse. If not, we can always deal with it without a history and go from there and figure out what's going on with the horse.
Yeah, you are. Sorry, I told Dr. Shalet that Brian would have some sassy horse comments.
Do any people keep their horses like in the basement?
Well, actually, I knew someone that had a miniature horse in their house off and on.
See, there you go. So the horse was in the basement. You said that you might be talking to the owner, trying to get the story, but you're looking at the horse. So because that's going to give you the real sign of what's wrong. What kind of things are you looking for?
Exactly. I'm looking for a lot of things. I've been around horses since I was a child. I learned from one of the best horsemen in the East Coast before I went to veterinary school. And I know what the demeanor of a horse should be. Of course, all horses are different. So I look at their ears, their eyes, where their head is. Is it low? Are they depressed? Now, sometimes horses can be very excitable. So when you first see them, they might not be acting like they normally do every day, being led in and out of their stall. So I give them some time to calm down if that's necessary. I usually pet them a few times because I really like horses, of course. And then observe their eyes. That's very important. Are they bright, alert, responsive? And then I move on to my procedures. The first thing I usually do is listen to their heart. That's pretty much always the first thing I do, unless I'm there seeing a violently sick horse, such as a colic, that's very fractious. Then we might move right into some medications. But I always listen to the heart rate. That's one of my most important tools. If their heart rate is elevated, even though the horse isn't showing it, then I think, well, is there some pain involved here? Horses are also excitable, so their heart rate can jump up threefold in just a very short period of time. And I wait for the horse to settle and then listen again and then move on with my examination. And I always make sure the owner knows exactly what I'm doing and what I'm observing with their horse and the facts that I'm finding out about their horse, whether it's a sick horse, a lame horse, and as I said before, if it's violently sick, like with a colic, then we move right on to medications.
Those, I guess, are the most frequent calls that you get with those conditions you just mentioned, like my horse is limping, that kind of thing.
Yes, lamenesses. Mm-hmm. And I always start with other things first because heart rate can tell me a lot, even if it's just lame. I don't leave that out because a high heart rate can mean severe pain. And then there are all kinds of things I do to determine what type of lameness it is and what we have to do from there. So the owner will learn all kinds of facts, all kinds of medical facts, and I try to explain everything so that they understand exactly all the words I'm using, etc., and then move on to treating the horse, whatever treatments we have to do. I like to let the owner know what options the owner has for treating this horse, whether it's sick, lame, it's an eye problem. And I also like to help the horse with the owner because when you're treating, say, an eye, some horses are not really happy with you putting things in the horse's eye. So we have to figure out ways to get that done if necessary. If there are medications to be administered, such as orally, maybe the horse will eat it in its feed, but possibly we have to administer it through a syringe in its mouth for the owner to do every day. So I like to help the owner understand what's going on.
Yeah, you told me that you're there to help the horse's owner as much as you are to help the horse.
Absolutely. The owner is intricate in the progression that we can see with the horse as it gets better for whatever it is, lameness, eye problem, respiratory problem, etc.
You mentioned that your horse might be depressed. Why would a horse be depressed?
There can be many reasons. They are sick. Maybe they have a fever. Because after I listen to their heart, I always take their temperature. Even if it's a lameness, people think, well, why are you taking their temperature? Because it might be lame because it has an infection somewhere, and maybe the temperature is elevated. So all of these things are very important to coming to a conclusion, a final conclusion about what we need to do with this horse.
You love horses. I mean, folks can tell you've been around them your entire life, and your clients really like your demeanor around the horses. Do the horses just kind of fall in love with you?
I would like them to. Some do, some don't. But I truly do love horses. I've been around horses since I was a child. I've been riding since I was a child, and I've been around people that ride, train, or just go out and pet their horses. There's just something about a horse that just laying your hand on their neck gives you a feeling that, of course, I love my dog. Everyone loves their dog, but it's different than petting your dog. And I have yet to figure out exactly what that is, but just being around a horse and laying your hands on them is a good thing.
Very calming.
Yeah, it's calming for me. It's calming for the owner. It's calming for the horse. And they understand that you're going to be kind to them.
You went to University of Pennsylvania Veterinary School, Penn Vet, which is Ivy League, one of the best in the country.
Yes, especially with their equine part of their veterinary school, which is located at New Bolton Center. I spent a lot of time out at New Bolton Center, and I loved every minute of it.
If you have a question about your horse, Dr. Shalet welcomes those. She really wants people to reach out to her just to talk about their horses, right?
Yes, I do that all the time. And sometimes it's people that I don't know and have never talked to me before, and I want them to get to know me. And if you want to call me and just chit chat, that's absolutely fine.
Be careful. Be careful what you wish for, Dr. Shalet.
True.
And so Dennis wants to know what area you cover.
I live in Bedford. I cover about an hour. I like to drive an hour or less around Bedford, anywhere around Bedford. I go to Fincastle, I go to Lynchburg, Amherst, Franklin County, and I try to stay within an hour. Of course, some of my best clients are down in Rocky Mount. It takes me a lot longer than an hour to go there.
And we just kind of said that, and that basically if you can, within our listening area, Dr. Shalet covers it. If you can hear us, Dr. Shalet will come to you.
What if you're using the app and you're in Hungary?
Well, then I think people realize the difference. But now, is this a joke? A joke question? Used a tube to blow pills down a horse's throat. Is that something that happens?
Well, I use a nasogastric tube, which nasogastric means it goes in their nose and down into their stomach. Most of the time, that is used as a treatment for colic. And colic is very important to have treated. It can be deadly. Sometimes I actually make referrals to surgical institutions around the local area. I allow people to decide what surgical institution they want to go to, or there aren't very many that are that close. So they only have a couple of choices. But putting that tube up their nose and into their stomach is the only way I can administer a lot of medications in some cases, usually colics.
Do horses like having tubes stuck up their noses?
Often not. In fact, never. But it's amazing how, and if you're quiet and you let them know that it's just going to take a few minutes, if you can actually tell them that, which you can. Sometimes we have to use restraint. Restraints are important to protect the owner and the horse, such as a twitch. But a lot of horses don't need that. And I tell you, if they're really sick and depressed, I can usually just insert the tube and get done what I need to do without any problems.
Now that I wish she could practice on Brian. And we could show the listeners, right, Biscuit? Wouldn't that be fun?
I mean, I think it's a great idea.
Yeah, it's a great idea.
I think tubing a person would be a lot harder than a horse.
You could try it. All right. I think listeners would want to see that.
Yeah, I think that would be difficult, I have to say.
So there's only one way to find out. So, and you do purchase exams. Those are very important as well.
Yes, I do purchase exams. I think they're very important. A lot of people buy horses without purchase exams, and that's fine too. But if you're expecting it to be any type of performance horse or just to live out its life with you without too many problems, that purchase exam is very important because I can identify maybe lamenesses that aren't really noticeable to most people. I can identify eye problems, which in some cases can be lifelong eye problems, and do you want to own that? And many other things, including listening to their heart, if they have arrhythmias that we need to know about. And they are important, even if it's an inexpensive horse, anywhere up to a very expensive horse. It is important.
We're speaking with Dr. Suzanne Shalet, All Around Equine Veterinarian. allaroundequineveterinarian.com is your website, and we're going to give your number here in just a minute, 846-8255, if you have a question about your horse for Dr. Shalet. You treat all kinds of horses, and you've been around them, even show horses, and why are horses? You've mentioned lameness quite a bit. What's the most used? Often, why are horses lame? In other words,
there are many, many reasons why they're lame. So I have hoof testers, and lots of horses are lame because of a foot problem. So when I'm doing a lameness, whether I think it's their foot or not, I use my hoof testers to see if there's any sensitivity in the soles of the horse. That can be my first indication of why they're lame. But you can't have a high-level performance horse that's lame. So if it is lame, we need to figure out why it's lame. We need to figure out what kind of treatments are necessary. And even if it's just a pasture horse, there are certain lamenesses such as laminitis or founder, which can be life-threatening in some horses. So we need to treat those and get them help, whether it's by shoeing, trimming, boots, blood work to tell us whether they need medications. There are many things that we can do.
A listener wants to know if you fix donkeys.
I do work on donkeys, yes.
Are donkeys smarter than horses?
Well, some people think they are.
Horses are really, really smart, aren't they?
Oh, yes, just the smartest animals on earth.
Well, donkeys
we wish.
Donkeys, aren't they very calming for the horses?
They can be.
Mm-hmm.
They can be a little different to work with.
Mm-hmm.
You have to do different things to restrain a donkey as opposed to a horse if you're doing treatments. But donkeys are adorable, and some of them are just so sweet.
They do have a reputation, though, for being obstinate. Are donkeys hard to work
they
with
can
that way?
be stubborn,
Yeah,
yes.
stubborn.
More
Mm-hmm.
than horses sometimes, yes.
Dr. Suzanne Shalet, and you invite folks to call you, call or
Yes.
text you.
Call or text me anytime you want to, and I will respond as soon as I can.
You're sometimes with a horse, and so it takes a while, like, doctor with the patient. And even you kind of gave a little sigh when we heard about the snow that's coming in the forecast, because horses still get sick. Horses still need treatment when it's bad weather, so you might very well be out in the middle of it, right?
Yeah, hopefully the roads have been cleared and it's not so hard to get there.
Oh, okay. So I'll tell you what, let's take a break. We're going to take a break and come back. Can you stay with us for one more segment?
Absolutely.
Because I think we have a very happy happy client on the line who wants to talk about you, okay?
Lovely.
846-8255. We'll be right back with Dr. Suzanne Shalet. And Catherine is on the line. Catherine, so your horses have been customers of Dr. Shalet?
Yes, good morning. My name is Catherine Bowling, and I'm here with Brooks Arrington. We've been lifelong clients of Suzanne Shalet, and we just heard her on the radio and wanted to call in and thank her for all of the great care we've had over the years. She is diligent. She asks good questions. She really takes a whole comprehensive healthcare approach to equine healthcare.
Well, thank you so much, Catherine. I'm so glad you were listening. And Brooks. Hi, Brooks.
Hi there. How are you?
I'm fine.
Catherine, have you guys had a lot of horses over the years?
Oh, I've only had a few, but my colleague here, Brooks Arrington, how many do you think you've had? Well, through the years, there's been a lot. I've bored, so Catherine's one of the girls that boards here. And at one point, we had 36 up here, and I was breeding show ponies. And Suzanne Shalet is the one that got all of my mares bred, got them all taken care of. She foaled them all out, and she has an extensive knowledge of lameness. I just love her for all of her lameness
Well,
problems.
thank you, Brooks. And I remember we had a lot of fun when I came out there every day to work on your mares.
Thank you, Catherine and Brooks, for calling in. We appreciate it. And Dr. Shalet appreciates it. So you've done, I was asking before about, do you help the mares deliver the foals? And you say a lot of time that happens so quickly that you won't be able to get there in time.
It's a very dynamic process. If that foal's not out within 20 to 30 minutes, usually there's a problem. So I don't always get there at the birthing process, but right afterwards or however time allows, I do a thorough examination on the foal. A lot of things can be going on, even if it's just a newborn foal, and we need to get it nursing as soon as possible. That's very important because a mare has colostrum. That's the first milk for the foal, and that is extremely important for that foal to consume that colostrum within a few hours of birth.
Dr. Shalet, tell folks, give your number, and you're encouraging anyone if they just want to talk about their horses or they have a question to give you a call, give you a text, and you'll get back as soon as you can. But what's your number?
My phone number is 540-874-4893, and I do welcome all calls.
Dr. Suzanne Shalet, and your website is allaroundequineveterinarian.com. Thanks so much for being with us.
Oh, thank you for having me. This was really lovely.
And I know that I hope that you don't get any emergency calls during the snowstorm that we're expected to get.
Well, we'll see what happens.
You're
never
ready
know.
to go in your big truck anyway if it happens. Dr. Shalet, thanks so much. We'll talk to you soon.